Marginal zone lymphomas are a group of three subtypes: the marginal, the splenic, the nodal marginal zone lymphoma, and the extranodal or MALT lymphoma. And overall, they represent 6 to 9% of all non-Hodgkin lymphoma cases. They're usually indolent in their disease course, but there is a kind of heterogeneity that puts together a patient with a very good features and very good outcomes, along with a smaller group of patients who have a more aggressive disease. There are today several prognostic factors that have been validated. None of them, however, has been designed for the whole group of marginal zone lymphomas. We have specific prognostic index for the splenic subcase, the HPLL, published by Montalban and colleagues in 2012. And we have a specific index for the MALT lymphomas that is called the MALT-EP, published by Catherine Tiblemont in 2017. What we are missing, however, in this analysis of prognostic factors for marginal zone lymphoma is a common view of these cases and the ability to identify a significant proportion of patients who are planned to behave in an aggressive way. At ASH 2018 in San Diego this year, new data have been presented from a real-life observational study, the Italian NF study that I had the honor to coordinate, where we were able to show that the concept of time of duration of response that has been developed and is shown to be the most prognostic factor, the best predictor of overall survival in follicular lymphoma, is being confirmed also in marginal zone lymphoma. In this study, 18% of the patients that were analyzed, there were patients with marginal zone lymphoma that required systemic immunochemotherapy, were early progressors, and for this patient, a worse overall survival was foreseen, with a 19-fold increase of the risk of death for this patient compared to the patient that never relapsed. What was also interesting is that it could be the risk of early progression could be predicted by anemia at the time of diagnosis, by thrombocytopenia, by lymphopenia. And also very important, from this real-life study that included several types of treatment, it was also shown that another independent factor was treatment. So what came out from this study that of course need to be validated is that for a certain group of patients that can be up to 18% of cases, a poorer outcome is foreseen when treatment is required. And for this patient, we first should try to understand which are the driver of the higher risk of mortality, and also which are the possibility we have to overcome these bad features of the disease.